Okay, so everybody knows the U.S. Food and Drug Administration regulates all medications as far as pharmaceuticals. That does not include natural supplements. You know, none of those are FDA approved. They may or may not work. Take them at your own risk. They like to scare you about those things. Sometimes I'm more afraid of what the FDA approves. Um, okay, so for off-labeling, once again, I told you there has to be at least one study done to use drugs off-label. So just always keep that in your head. So what does the U.S. Food and Drug Administration regulate? All your prescriptions and your over-the-counter medications, meaning like your Tylenols when I say over-the-counter, Tylenol, ibuprofen, things like that. They also, you also need FDA approval for medical devices, and that includes your artificial joints. So any medical devices, CPAP machine, things like that, but hips, knees, all of that. So keep in mind of that too. That just doesn't come from anywhere. So let's see. We're going to go into drug testing. Okay. New drug approval, the process that they go through. So an investigational new drug, or an IND is what they call it, is filed with the FDA. What can happen then? When is preclinical research that's filed prior to human testing? So you need to know what that is. Preclinical means it's filed before human testing, okay? And then that's before any of the phases. It's preclinical research. It's filed prior to human testing. So then you have your phase 1, your 2, your 3, all your clinical trials. Phase 4 is known as your post-marketing research. So that's once the drug is out there. So you need to know post-marketing research is phase 4. I don't think there was phase 4 originally in the PowerPoint, and I'm not so sure phase 4 is actually even in that chapter of reading. Kind of unfair then. Post-marketing research is phase 4. Okay, here we go again. Official labeling then. FDA regulates that. Okay, here's your off-label. Only legal if there's scientific evidence. To have scientific evidence, there must have been at least one study. So there is a reason why I keep telling you that. Okay, so U.S. Drug Enforcement Administration, what do they do? What does the DEA do? They register, what do they do? U.S. Drug Enforcement, DEA, you have a DEA number, so it's registration with the DEA. It registrations manufacturers, prescribers, and dispensers of all controlled substances. Alright, so that would be you. If I haven't told you before, I'll tell you now, you need to know all these schedules of your controlled substances. What's a 1? I guess we can't prescribe 1 unless we start prescribing heroin. So you have 2s, 3s, 4s, and 5s. So most practitioners can do 2s if their collaborative physician lets them do a 2. Not everybody will let you do a 2. I don't even know if you really want to do a 2. 2Ns, class 2 is also, schedule 2 is divided into 2 and 2N. 2N is like your Adderall, but it's the non-narcotics. Here's all your examples. So here's what you need to know. No refills are permitted, so you have to have a hard script all the time. You have to hand them the script, and it expires in 72 hours if not filled. You have to come back for your script, and it gets to be a little messy. Usually people come in and run in for their script, run out, and run right to the pharmacy, and that's the best way to do it. You have to take special precautions with your scheduled drugs, your controls. So you want to always make sure that they're on that tamper-proof paper. A lot of them are e-scribe now, and they can still be on tamper-proof. My office is not doing the right thing. Comes off regular printer paper. That's really not okay to do. You need the tamper-proof paper. That's the most important thing. So remember, tamper-proof paper, your name, your NPI, your DEA, your date, no refills, and you have to spell out the quantity. Now you know I've had you write you had to turn in that prescription assignment, and you write them too. A lot of you have been doing a great job with the discussion board, and you're writing the discussion. You have to spell out the quantity. So if I have Norco 5 325 tabs, give one tab, Q6 hours, PRN for pain. Number 90 has to be spelled out. I can't write 90. So all 2s, 3s, 4s, 5s, 2Ns, spell out the quantity. And then a test question, this is the right way to do things. Every practice has their certain amount of patients that come in and just want controls from you. What are you going to do? That's the thing. It's a little bit difficult for opioids and other things. So what are you going to do when you have somebody who consistently comes in? There's chemical dependency tools that you should be assessing for. Sometimes your MAs will do that. You also need to look them up on the prescription monitoring site. You also are able just to say no if you've assessed the situation and you think that this is getting to be a bit much. So you can have a pain contract as well for these patients. But the other thing too, if it gets to be much, say no and send them off to the pain clinic. And usually they'll come right back. Looking for you to give them some more. So there's some behaviors that are predictive of addiction or controlled substances, and you can usually see it via the controlled substance monitoring site. A lot of times they'll steal or borrow another patient's medication. So they'll come in to you and say, yeah, I borrowed 90 Norco from my friend and it worked really well, so now I want to have the script. So that's a big red flag for you, and that's actually it is on that questionnaire if you've ever borrowed or stolen medication. Don't forget about the pain contracts. Universally for all prescribing, whenever you're prescribing for everybody for chronic pain, everybody, whether they're legit or not, if they're really having pain or not, you want to have a pain contract. Need to write a prescription for all drugs, legend drugs, controls, medical devices, everything as well.